The first issue that I'm going to touch on today is prescription drug prices. This is one issue that has really come to the forefront over the last year or so, with Martin Shkreli of Turning Pharmaceuticals last year raising the price of their generic drug by over 5,000%. And then just recently with Mylan and EpiPen, this issue is really at the forefront of voters' minds. In one poll from last year, prescription drug prices came in as the top 2 healthcare priorities for respondents, as you can see on the slide here. Both major party candidates have addressed the issue on the campaign trail, with Donald Trump briefly mentioning it in his 7-point healthcare plan, and Clinton recently releasing an extensive plan to adjust drug prices, sort of in response to Mylan. We also see this playing out at the state level in interesting ways as well. At least 12 state legislatures introduced bills over the past year or so that would in some way require these pharmaceutical manufacturers to disclose what they spend on the drug creation process in order to justify their prices. Vermont became the first state to enact such legislation in June of this year. And then there's a measure on the California ballot this November that would restrict the amount state agencies pay for drugs to what the U.S. Department of Veterans Affairs pays. We're seeing a lot of money being poured into this measure, with the total from both the support and opposition campaigns amounting to over $100 million. And while not necessarily an influence on elections this year, we've seen at least 6 states sued over policies, either in Medicaid or the state prison systems, that restrict coverage of hepatitis C drugs to certain patients. These are drugs that were labeled breakthrough drugs by the FDA because they cure 95% of cases, but they are also incredibly expensive, in the tens of thousands of dollars. For this reason, many states have restricted public coverage of the drugs to hepatitis C patients that already have a certain level of liver damage, and 6 have been sued over those policies. So this is definitely an area to watch and where we could see more conflicts in the future, especially as the number of specialty drugs, which are these drugs that treat rare or complex conditions like hepatitis C and are very difficult to replicate as generics. As the number of these drugs on the market increases, and if the FDA's backlog of generic applications continues, this could definitely remain an issue through the election and even beyond. So the Affordable Care Act, or Obamacare as it's commonly known, has remained an issue in this election. Part of the Republican platform this year is repealing the law almost in its entirety, and Donald Trump has pretty much proposed something similar in his healthcare plan. Clinton, on the other hand, likes the ACA and wants to expand the subsidies and expand coverage, along with introducing a public option to sort of compete with private plans that are offered. Today, 11% of Americans remain uninsured, compared to 16% in 2010. Despite this success, health insurers are concerned about Obamacare's financial sustainability, which I'll talk about more in a bit. And fewer participants are reporting that the law has helped their family. More than half of Americans say Obamacare has had no effect on them or their family. And we have a public that is still nearly evenly divided in their view of the law, with the percentage viewing it unfavorably down a bit from earlier in the year at around 42%, while those viewing it favorably held relatively steady at around 40%. And an older poll from January 2015 found that half of respondents felt that it was important to continue the debate over Obamacare. So we are definitely still seeing disputes over this law. As some of you may know, the Affordable Care Act provided for states to expand their Medicaid programs to cover childless adults up to 138% of the poverty level. Previously, if a state wanted to do this, they would have to get a waiver or permission from the federal government. Medicaid expansion is still a big issue at the state level, especially in the states that have not yet expanded, and even in a couple that have. Decisions to expand the program have often been made in the state legislature or in 4 states through an executive order issued by the governor. So far, 31 states, including DC, have expanded Medicaid, while 19 have not. And of those 19 states, 17 are Republican trifectas heading into this election, which is another way of saying that the Republican Party controls the governorship and both chambers of the legislature. Historically, of the 25 states that did expand Medicaid prior to 2014, 13 were governed by Democratic trifectas, 8 were under divided control, and just 4 were Republican trifectas. So the partisan composition of these offices has been and will continue to be a big factor in the decision to expand Medicaid. And then at the federal level, the party affiliation of the next president could affect state expansions as well. Because when a state wants to expand their program, but in an alternative way, such as using Medicaid funds to enroll beneficiaries in private coverage, those proposals must first be approved by the federal government. A Republican administration may be more likely to approve alternative expansions that this administration has rejected. And if Clinton wins the presidency, some have speculated that Republican governors who have so far held out against expansion but have been open to the idea, these governors may consider Obamacare as a settled part of the healthcare system and may decide to move forward on expansion. So recently, there's been a lot of news surrounding the health insurance exchanges. Last year and through the middle of this year, all but 6 of the 23 co-op health insurance companies created under Obamacare closed or were shut down by regulators. These were nonprofit companies created with low-interest loans under the law that were intended to compete with larger insurers on the exchanges and provide consumers with more lower-cost choices. But many of these co-ops were in a precarious financial position after their first year due to premiums that were set too low, generous benefits, and enrollment that as a result grew too quickly to sustain. They attracted a disproportionate amount of less healthy enrollees and lost a lot of money quite quickly and were shuttered by state regulators as a result. And this phenomenon, where sicker individuals have been more likely to purchase insurance than healthy individuals, has affected other insurers as well, some who have been losing money at what they characterize as an unsustainable rate. So throughout this year, we've seen 3 major national health insurers, United Healthcare, Humana, and Aetna, announce intentions to withdraw from most exchanges in 2017. And on a state level, some smaller regional insurers have decided to withdraw as well. So we have 5 states where just 1 insurer will offer plans on the exchange in 2017. And then for those insurers that will continue to offer plans, we've seen that they have requested average premium increases of nearly 25% from their respective state regulators, with these increases being as high as 50% in some states. Those who receive the federal subsidies to help pay for their premiums will not be so much affected, but individuals who make too much to qualify for the subsidies or who purchase their plans off of the exchanges in the regular individual market will have to bear the full cost of those increases. And if that trend continues, the federal budget could ultimately be affected as they pay out more in subsidies. So these factors have some questioning the stability and sustainability of Obamacare's insurance model, while others think that this is just part of an adjustment period as insurers learn the new individual market. Only time will tell there, but in the nearer term, this could affect how individuals in some states, especially the ones that are struggling the most, view the law, and by extension, the officials administering it. And so the final issue that we've been looking at is healthcare spending and costs. This has been something that has worried policymakers for years and years. Currently, healthcare spending sits at 17.5% of the nation's GDP. It's about 1/6. And it's projected to reach nearly 1/5 of GDP by 2024. So that's massive amounts of money moving through this industry. Healthcare spending did grow at a slower rate between 2008 and 2013, but there has recently been some evidence that the rate is picking back up again. This rising spending can be tied to both greater use of healthcare services and greater prices and costs of these services. And these costs are quite worrisome for consumers. Among the remaining uninsured, half say that they have not purchased insurance because of cost. Rising healthcare costs can mean less disposable income for consumers, greater expenses for employers to hire new employees, and pressure on budgets for states and lawmakers. So we've seen some efforts from states to control health costs and spending. Many states have databases where they collect information on insurance claims to track use and inform policymaking. Some states are introducing price transparency measures to try and get hospitals and doctors to disclose their prices upfront before the service is provided. Maryland is one state that's taken a more direct approach for a few decades now by rate setting hospital prices and setting these global budgets or these overall budgets for hospitals. Vermont recently won approval for a similar approach as well, where they will require all third-party payers, including Medicaid and Medicare, to reimburse providers at similar rates for services, with those rates then determined by the state. So a lot going on here with lawmakers under increasing pressure to keep down health costs. And so now I would like to go ahead and open it up for questions.
Cool, thank you, Sarah. I just want to remind everyone that we have both a chat and then a Q&A tool that you can use. I'd like to start off with a question. So in these states, these 5 states that just have one insurer on the state exchange, do regulators have any tools to try to keep costs low?
Yes, they have some tools at their disposal to try and hold down costs. In most states, insurance departments can review premium rates that insurers request for the following year and can either approve or reject those requests. Regulators in a couple of states have also allowed insurers to set caps on plan enrollment for the upcoming year in an intent to control costs. And in a couple of other states, legislatures have established programs that kind of reimburse insurers for their high cost enrollees to try and prevent them from raising their premiums or leaving the market altogether.
Awesome. And I actually have another question for you. What would happen if all of the insurers left a state exchange?
So this is a really interesting question. There's not really a backup plan in place to address a situation where there are no insurers willing to participate on an exchange. People would still be able to purchase plans off the exchanges, but they wouldn't receive federal subsidies to help with their premiums because those are only available through the exchanges. The government also can't require insurers to sell plans on the exchanges or use any legal mechanisms to sort of nudge them into doing so. Obamacare did originally call for setting up 2 nationwide plans with willing insurers, but only one insurer has volunteered. And the government found that providing this type of coverage is very difficult. In a case where there is an area with no insurance offerings, a company may see that as an opportunity and decide to sell there, though probably at higher rates. That's what happened in Mississippi right at the launch of the exchanges, and in one county of Arizona this year. And that's also one reason that Hillary Clinton wants a public option, so that there's always to kind of act as like a backup plan for there to always be one choice for consumers.
Oh, that's so interesting. We have a question from one of the attendants. Are the regulators federally or state appointed?
I believe that they are state appointed. They're part of the state administration.
Great. Well, that's all the questions that we have for today. I want to thank everyone so much for their time and say that if you have other questions, please reach out to us. You can email us, editor@ballotpedia.org. We're also on Twitter @Ballotpedia or facebook.com/Ballotpedia with other questions. And next week, we have 3 more webinars at the same time that hopefully you can join us for. One of them is on trifectas, which Sarah talked about a little bit today. One's on, and then battleground races at the state level and at the congressional level. So hopefully we can see you all for that. Have a great day. Thank you all.